is Erin, and I am a Texas State student with the Department of Physical Therapy. And I am going to talk to you today about how much exercise is too much exercise. So how to know when you've overdone it. So the first thing we're going to talk about is pain. So after you exercise really hard, it is normal to have a certain amount of muscle soreness. That's how we get gains and get stronger. However, if you are feeling an inordinate amount of pain or specific types of pain, then that is an indication that you've gone too far. So some things that you can use to determine how to see if it's soreness or if it's pain that's problematic are to think about the onset. So when you have soreness, it's going to come on 24 to 72 hours after you're done working out. If you've done something that is injurious to yourself, then that could be painful directly at the time that it happens, up to about 24 hours afterwards. So if you're having immediate pain while you're working out or right after you finish, that could be an indication that you've done too much. Another thing to keep in mind is the duration of the pain. So normal muscle soreness lasts about 2 to 3 days. If you're still in pain a week after you've worked out, then that is another indication that you might have hurt yourself and you need to cut it back a little bit. Things that make that pain better are resting, icing it, elevating it, the normal things that you would think of when you injure yourself. When you are sore, more activity should actually feel better. So keeping it moving and kind of stretching and doing gentle movement should actually help your pain. So that's another way to tell if you are in pain from muscle soreness or if you might have injured yourself, is if sitting makes your pain worse, then that is an indication that it's just general muscle soreness. If you are having more pain with continued activity, then that is an indication that you might have injured yourself. So those are some ways to tell pain from injury versus muscle soreness from working out. Now we're going to move on to talking about ways to know while you're exercising that you're doing too much, you're pushing yourself too hard, and you're getting to a place that is no longer a healthy workout but could be dangerous to your health. Things to look out for are dizziness, lightheadedness, if you're sweating profusely or if you've stopped sweating, that could be an indication that you're dehydrated. If you get cold and clammy, that could be an indication that there is a cardiovascular issue, as well as if you have heart pain, chest pain, or if you have pain on your left side, in your neck or your shoulder, or your arm. All of those are indications that there could be a cardiorespiratory issue or that your metabolism is not keeping up with the demand that you're putting on it, and so you should stop, take a rest, drink some water, and recoup. Another thing that you want to consider are what is the recommended amount of exercise? And so the American College of Sports Medicine puts out their recommendations, which are 150 minutes of moderate activity per week or 75 minutes of vigorous activity. And that can be accompanied by 2 to 3 days a week of strength training. So if you're within these parameters, then that is a safe and healthy amount of exercise to get per week. You also want to make sure, when we're talking about metabolism and metabolic intake versus outtake, you want to make sure that you are intaking enough calories for the amount of output that you're giving. So if you are working out a lot, if you're working out many times a week, you want to make sure that you're consuming enough calories to support that amount of physical activity. You can track this in a number of ways. There are a lot of food tracking apps, as well as myplate.gov has a really great program that you can track your calories as well as your physical activity to kind of help you monitor that. There are dangers if you are exercising past the point of your calorie intake, and that includes damaging your bone health and also your metabolic health. So it can lead to things like poor bone density, osteoporosis, and amenorrhea for females. So those are things to keep in mind. So in conclusion, if you are working out really hard and you feel dizziness, those symptoms that we talked about cardiovascular issues, if you feel while you're exercising that you're injuring yourself, or immediately afterwards, or if your metabolic intake is not proportionate to your output, then you might want to slow down and reconsider your regimen. I hope this has been helpful information, and thank you very much.